The Minister of Health and Coordinating Minister of Social Welfare, Ali Pate, has been discussing the government's efforts to curb the current cholera outbreak, which has claimed at least 53 lives. At the Federal Executive Council meeting, Mr. Pate outlined measures to address ongoing disease outbreaks and acute malnutrition. Now, these issues were the key points of deliberation at the meeting.
It is multi-sectoral, has technical partners, has other ministries of water, environment, Ministry of Health, other relevant partners, civil society, contributing in that effort to ensure that we manage this. And resources were deployed to 21 states to help them respond to the cholera, in addition to improving awareness of our population, hand washing, hygiene, sanitation, in addition to treatment with drugs, with intravenous fluids, with oral rehydration solution, and widely spreading the message that people should be aware of this outbreak of cholera. When you look at the magnitude of the problem globally, the shortage of cholera vaccine is a global issue. We don't produce the cholera vaccine here, and it's not produced even in Africa. So before we get to that point, there are some basic things that we will do. Hand washing, better sanitation, hygiene practices, prompt treatment, and we have engaged the global actors who have access to those vaccines already to identify sources of those vaccines that we can use.
And as the spread of the disease continues, there's concern about the role of primary healthcare agencies in containing the spread. Well, joining me now is Dr. Janet Ekpenyong, who is a former health commissioner in Cross River State and former CEO of primary healthcare agencies. It's good to have you on Newsnight tonight.
Thank you so much for having me. Good evening.
Yes, I mean, being an expert in primary health care, there's no better person to help us understand why the PHCs, the primary health care centers, are not able to step in and close the gap in terms of, accessibility to health care at the primary level. What exactly is wrong? What's the problem here?
Okay, thank you very much. We all know that the primary health care is actually the foundation of the health sector. And I know that even the federal government have been doing a lot to see how it can strengthen the primary health care. In terms of tackling diseases, however, sometimes it could get overwhelming, but I'm glad that with the current efforts being put in by the government, I'm very certain, I think they've been very proactive so far, and that's why we've actually been able to record very minimal number of mortality. But I must say that we still have a whole lot to do, because it's expected that at least in every ward in the country we should have a functional primary healthcare facility, and in every community you should have at least a health post. And unfortunately, I must say that we still have communities that are even yet to have health posts. But I'm very encouraged with the current drive by the federal government to ensure that every community at least will have that. And I'm very sure that that will really help us to curtail some of this outbreak. And another major challenge is around human resource, for health, which has always been a very big challenge in the health sector, not just in Nigeria. I mean, it's like a global challenge.
Right.
But with the employment of skilled health workers, and we're also very certain that that will also be tackled. But disease outbreak usually is inevitable, and most times because of the weather. Currently we are in the rainy season where there's flood and the rest of that happening in various communities across the country. But we know that the primary healthcare has a huge role to play in curtailing this. I mean, that's the first point of response, and with what the Honorable Minister has also said, you could see that government has been acting proactively. And I know that they've sent in a lot of, drugs and the rest of it to help curtail the spread. So I'm certain that a lot will be done in that regard.
Whatever government is doing presently, I mean, if you go by the 2023 figures and reports as to the state of Nigeria's primary healthcare centers, only about 10% of the 33 or so thousand PHCs across the country is actually functional. That really truly is dismal, and we wonder how, I mean, how much can governments do at this point now to be able to, mitigate the impact of this cholera outbreak? What needs to be done at the PHC level now? I mean, let's just say it on a clean slate to make a primary healthcare center functional. What needs to be in place?
Okay, so first of all, I think I also like to state here that when it comes to health, it's everyone's responsibility.
Right.
It's not just government's responsibility. Even those at the community level, even as an individual, you also have a role to play, in ensuring that, Nigerians are healthy.
Right.
So at the primary level now, we expect that we should have a facility. And in that facility, we expect that we should have drugs, the basic drugs, because at that primary level, you're supposed to provide basic services, So once you have the right equipment, the right drugs, and of course, the manpower, that will help strengthen services at the grassroots. And that has always been the major challenge. And that's why I said, if you see the focus of this government, they're really working at strengthening primary healthcare facilities, services, because once you're able to tackle it at the grassroots, then of course it's like a ripple effect. It also, it transcends all the way to the secondary, And some of the diseases that we actually see, they are things that can be managed at the primary level.
Absolutely.
Yes. So
like this cholera
outbreak, disease. So I must say that we still need to do a lot. I'm not saying that we're there yet. A whole lot still needs to be done. And I think it's just one step at a time. But like I said earlier, it's everyone's responsibility. Even as an individual, as an organization, if you're looking for where to support or where to invest, as even at the private sector, you should also look at the primary health care to see how you can support our primary health system, because the whole lot still needs to be done. And like here, it's going to be one day at a time, one step at a time.
Yeah, at a time.
I'm sure we'll definitely get there.
Let's talk about, growing up, there used to be something called, community health workers. I'm trying to use the more local term, the woles, sanitary inspectors. Yeah. In tackling this outbreak, this cholera situation now, would you advise that, that should be incorporated in the war against cholera to ensure that, the figures that we're seeing actually stay there, not, go more than 50?
Yeah. So one of the best ways of tackling such outbreaks, a whole lot of sensitization.
Right.
And these are the people that will also support or help in ensuring that our people can be, they can create that awareness, and that's environmental officers, health, community health workers, and the rest of them. So just as, like the minister mentioned, it's a whole team. It's not just the health sector, it's multi-sectoral. Right. And at this moment, a lot of sensitization will be done at the grassroots, because they have to be moving almost from one house to the other, talking to people on the importance of hygiene, personal hygiene, environmental hygiene, food hygiene, and the rest of it, because of course sanitation, ensuring that people are not defecating in the open, ensuring that a lot of hand washing, clean water, access to water. And we understand that a lot of our communities right now might not have, borehole, however, even if it's a stream, you need to, create awareness that people should not defecate in this stream, because like right now we have flood. The water could, wash off to
anywhere,
anywhere, and then lead to such outbreaks. So of course, their role in ensuring that we can curb this outbreak, it cannot be emphasized. So it's holistic, approach. So a lot of sensitization, while we are also battling with treating those that are already infected. At least prevention is key right now.
You've been a health commissioner. I mean, that's at the state level. And I'm wondering what role, what kind of action should the state governments be putting in place now? Because really, this is at their doorstep, is at their, within their domains. What should the state governments be doing in terms of, action?
So, while of course we are going about with sensitization and creating awareness, at this point, places where these cases have been identified, it's important that we set up an emergency response team in each of our communities. And places where we've actually identified these cases, we must ensure that they have access to care,
right.
you know, while getting people hydrated and treated and managed and the rest of, but also be able to identify what the source, you know, of this infection is coming from, whether it's from their drinking water, whether it's from contaminated food. Being able to isolate that will also help to curb the spread. But most importantly, we must ensure that we have health facilities that are functional in that community that will be able to, you know, cater to this people who come down with the disease, while of course having your response team that will be ready to respond at all times, you know, when this comes up. Then of course, like he said, you're not working in isolation. You also have organizations that are willing to help, other international organizations such as the World Health Organization. They're always on ground. Also have some other you know, organizations there that will be ready to support. So right now you must have, you know, a health facility that will be rendering services to people who are infected. You have your response team on ground who are also going to be there to respond, because some of them might even have to visit, you know, people's houses, you know, to bring out these patients or these people from the various houses to the health facility. I'm
thinking we can even use the national immunization template as a way of getting, you know, really close to the people. Let's talk about the vaccine that the health minister talked about earlier. I mean, we're shaking our heads here when we heard him say, look, vaccines have run out of vaccines. No African country is producing or manufacturing vaccines. I mean, I wonder what your thoughts are as far as that's concerned.
Yeah, it's heartbreaking, and of course it's also a very scary situation. And that's why we are hoping that very soon, Africa at least, we should be able to produce these vaccines, because they'll go a long way in helping us to curb, you know, the spread of these diseases. And prevention right now is just the focus. We just have to see how we can create more awareness and ensure that we can prevent these diseases. However, because even with the vaccine, it only provides very short immunity, you know, so you still have to create that awareness. People just have to, there has to be that consciousness.
We need to go.
You know, states have to be working to ensure that even at the schools,
everybody
food
should
vendors,
work in tandem.
everyone at this point just needs to see how they can work with government to tackle this outbreak. Yeah.
Thank you so much. Janet Ekpenyong is CEO, Primary Health Care Agencies, former CEO, and of course CEO of Health Commissioner in Cross River State.
Absolutely.
Thank you very much for joining us.
Thank you very much for having me.